Can I welcome you all again? It's really great to see such a turnout on a Saturday. Okay, I'll say more about my Pluma Fellowship later on today when I give my Pluma lecture, but now I'm going to focus on a kind of introductory scoping review on the health of black women. Now, my focus is on black women, and by black women, I mean black African women, women from the Caribbean, mixed heritage women. But even though what I say is about black women, a lot of it relates to other women and other women of colour. But my focus is on black women. Okay, so why do we need to focus on black women's health and well-being? And as Baroness Amos said earlier on, black women's health has been ignored for too long. We've been invisibilised in health studies, and we have limited data on the health issues which affect black women. So in order to try and address this, the Centre for Personalised Medicine actually supported an introductory scoping review. The review was undertaken by Robin Sargent. We had the assistance of Dr. Ute Manica from the Open University. And when we did the scoping review, we searched the literature for black British, black African, or black mixed race, or black mixed heritage women, or females, or women or females. So that was the kind of scope of our literature review. In terms of the methodology, we used the PRISMA Extension for Scoping Reviews guidelines. The review was limited because of the resources we had available. We didn't have as many resources as we had hoped. But still, you know, it's a start, and it's a start that we can build on. And so, what was our research question? Our research question is, what is the state of knowledge regarding black women's health, especially the evidence on disease prevalence, trends in disease, and gaps in the evidence base? And in the review, after doing the literature searches, we identified 8 research papers, which included African, Caribbean, and mixed heritage women living in the UK. Some of the studies were specifically on African women, some were specifically on Caribbean women, some were on that amorphous kind of term that's used, black, Asian, and minority ethnic women. Some were on black, Asian, and minority ethnic people. So we had to pull out the kind of different aspects. And I just want to relate this to a review of epidemiological studies in African Caribbean communities that was actually conducted by Lisa Array and Ciramani Harding in 2004. So that's nearly 20 years ago. And in their review, they found that the research emphasis hadn't really changed from the 1990s to the 2000s. And they identified 43 research papers, out of which 20 focused on mental health, 3 on sexual health, 13 on autoimmune responses. So really the focus of those papers was on mental health, but on mental health as a pathology of African Caribbean communities. So what I'm going to do is give a general finding of our scoping review, and then I'm going to focus on specific areas. Obviously, in the time available, I'm not able to go through all the areas that we reviewed. So we actually found 11 papers on mental health, about 11 papers on antenatal care, infant mortality and maternity care, 13 papers on sexual health and HIV, 5 on breast cancer, 7 on reproductive health and cervical screening, 9 on heart health and lifestyle, 4 on health status, and 3 on COVID. So that's quite interesting because we've got a kind of spread really of areas covered. But again, the studies varied quite a lot. Some were very small studies, some focused on a specific community. Some, you know, were kind of larger studies that looked at, I'm going to use the term, BAME communities. I hate the term, sorry. And the other topics that were covered, but not many papers, were dementia, workplace stress, barriers to genetic testing, and hearing and ethnic inequalities. So this is something we really need to build on much more in terms of doing a future review. So if we compare it to 2004, and remember that the review in 2004 covered all epidemiological studies on African Caribbean, so men and women. And this focus was really very much on women. We found that although there's still an emphasis on mental health, there are actually still a number of papers on antenatal and maternity care, sexual health and HIV. As I say, we must remember that this review focused on women. What was also interesting is that the reviews, the papers that we reviewed, the studies, sometimes focused on the sort of stereotypes that we have of different communities. And so in terms of African women, the focus was on HIV testing and disclosure of HIV status. And also a lot of the papers on sexual health were on African communities. So, you know, we need to challenge some of the stereotypes that we have about different communities and what gets researched and what doesn't get researched. So I'm going to quickly go through the kind of the issues around mental health. We have had a paucity of research, writing and research about the extent of mental illnesses such as anxiety and depression in African and Caribbean women, except for one author. Honestly, we kept coming across this author when we did our scoping review. Dawn Edge has just been prolific in terms of the work that she's written on black women and mental health. So we must be aware that the stresses of everyday living and the experience of living in a racist society often takes its toll on African and Caribbean women and has an overwhelming effect on our psychological well-being. In our review, we found that black and minority ethnic communities were at a higher risk of mental health problems and that there were higher rates of psychological distress in black and minority ethnic communities. And again, Dawn's work looks at the focus on black women's perinatal care, and that is particularly worrisome. And she also contends that low levels of perinatal depression amongst black Caribbean women mask the true reality of high levels of psychosocial risk and diagnosed mental illness, and undiagnosed mental illness. So, from Dawn's paper, in theory, psychosocial risks such as poverty, gender discrimination, and marginalisation place black British Caribbean women at high risk of perinatal depression. In practice, however, they are less likely than their white British counterparts to be diagnosed with perinatal depression and then to receive appropriate mental health care. Also, there were a number of articles related to emotional distress in Caribbean women, and these pointed to the prevalence and the persistence of the strong black women stereotype. And we all know about that stereotype, that black women are actually able to cope with everything. They're able to cope with being parents, workers, students, all at the same time. And you know, unfortunately, sometimes we as black women buy into that stereotype ourselves, and we think that we should be able to cope with everything because we are supposed to be strong black women. And this kind of stereotype frustrates the shaping of black women's access to and experience of mental health care. So we need to reshape the research agenda to understand the complex and broad range of interwoven modalities which influence African Caribbean women's coping and help-seeking activities in response to distress. One of the other areas that was highlighted in our review was psychiatric morbidity. And research by Cohort actually demonstrated that there were higher rates of imprisonment in secure hospitals in the African Caribbean community in the UK compared to the white British population. Now, I don't have the amount of time to actually talk about why that should be the case, but we know that particularly black men are more likely to be hospitalised for severe mental health issues. But even though there's an increased risk of imprisonment, African Caribbeans actually exhibit less psychiatric morbidity than their white counterparts. And a paper by Borrell also reported that drug-dependent black and mixed-race female prisoners constituted the highest proportion of women reporting self-harm. But all of this research needs to be put into context. And I think Dawn will say perhaps a little bit about that when she talks about mental health, so I don't want to... The other issue are suicide rates. And what was found in the literature is that there are elevated suicide or attempted suicide rates amongst Black African, Black Caribbean and mixed cohorts compared to white British respondents and the general UK population. So we're seeing more people either attempting suicide or actually committing suicide amongst the Black population. And one of the areas that was suggested is, again, based on this notion of the strong Black woman and or the strong Black person, that Black and minority ethnic patients and Black patients were actually viewed as lower risk by clinicians because they have this stereotype that Black people are stronger psychologically. So again, these are lots of issues and stereotypes that we must address. So coming on to maternity care, and as I say, we know about the experiences of maternity care and that Black women are less likely to access timely and appropriate care. I'm not going to read this in detail. And often, the respondents in this study, Henderson study, reported that they were spoken to in terms they could not understand. They were often not treated with kindness, and nor were they sufficiently involved in decisions with medical staff, which led to a disconnect in trust. So, and there is more research coming out on maternity care. And I think, again, if you look at the report from 5 Times More, they actually discuss how Black women are not listened to, Black women are not believed. So in the recent report by Embrace that came out just over a week ago, whereas in 2018, Black women were 5 times more likely to die from complications in pregnancy and childbirth than white women, it's now 3.7, so that's gone down. And I'm sure Chloe and Tanuke will talk to you about that. But I have every belief that part of the reason for that rate going down is because of the raising of awareness of Black women's experiences in terms of maternity care, both in terms of Black women themselves and Black women being able to respond to maternity services, but also in relation to practitioners and clinicians who are far more aware now of how Black women have been treated in the past. And in relation to Black women in stillbirth, Black and Black British women also exhibit the highest rates of stillbirths. And again, as with a lot of things, we don't know why this is the case. This is why we need far more research to actually be able to say why this should be the case. I'm just quickly going to go through breast cancer. Breast cancer. The research on breast cancer has highlighted the fact that Black Caribbean and Black African women are more likely to present with late-stage breast cancer than their white British counterparts. And they're also less likely to have their cancer detected through the screening process. So we need more research to find out why is this the case? Why is it that Black women are presenting later and that their cancer isn't being detected through the screening process? We also know that there are kind of barriers and delays to the diagnosis of breast cancer amongst all ethnic groups in the UK. So again, what the research highlights is that we need more research, that we don't know the reasons for these differences. Similarly, in relation to cervical cancer, Black Caribbean women are more likely to die from cervical cancer. So again, we need more research to present a clearer picture on cervical cancer in Black and minority ethnic women and its contributory factors. So just to quickly conclude, because I think I must be getting close to the end of my 5 minutes. Most of the researchers of these studies, and these are disparate studies that have been undertaken, point to the dearth of studies on different aspects of Black women's health and well-being, the inconclusive nature of their findings, and the need for more detailed research. So we have some data in the UK that provides information on the health of Black women, But generally speaking, there are limited data that explore the intersections of gender, race and ethnicity. And what we need, and you'll keep hearing me banging on about this today, we need a cohort study on black women, rather than small numbers of black women in existing cohort studies or small studies on small numbers of black women. We actually need a study that will track what our health experience and health status is as we go forward. And just to finish on a quote, many of you heard me say this before, from Leith Mullings and Amy Schultz, that health disparities based on race, racism, class and gender sexism are matters of life and death. And this is what we're seeing. We're seeing that black women are dying disproportionately. And I'm glad that you're all here today to start to think about some solutions. And as Valerie mentioned, we have the Black Women's Health and Wellbeing Research Network, which I hope some of you will go onto the website and join. And thank you. Thank you very much.